tried and tested which diets actually work for your Crohn's or colitis. If you're navigating Crohn's or colitis or supporting someone who is, you probably asked which diet or what should I be eating, what diet should I be on. This week I'm breaking down the top Crohn's and colitis clients' diets to try and what the science says and what can help, what can harm. Spoiler, there's no one size fits all, but understanding the pros and cons can help you make the most informed and empowered choice. Let's dive in. The top diet that a lot of Crohn's and colitis patients use is number one. That would be specific carbohydrate diet, SCD. So let's talk about pros and cons on all. Pros would be it may reduce symptoms and inflammation, but focuses on simple and real foods. Cons could be highly restrictive and not easy to follow long-term, risks of deficiencies. It can feel a little limited, and it will deplete you of good fiber, and long-term I've seen more issues than help. But in the beginning it can be very helpful. Number two, low FODMAP diet. So that can feel really good in the beginning, right? Less gas from it. And the pros would be excellent for IBS-like symptoms, bloating, gas, well researched. But for cons, it would be it's not designed for long-term use. Can limit your prebiotics and what your gut needs for that good diversity. So again, long-term is not an option here. Number three, paleo diet. So this is often, it feels comfortable for a lot of my clients. And the pros that it's anti-inflammatory, it eliminates processed foods and grains, but it might be too rough during flares because it is higher in fiber and fat and can feel heavy and it's not personalized. Number four, gluten-free and dairy-free. So I have most of my clients on this, and I'm very much a big proponent for gluten-free and dairy-free personally, for myself. For pros, it's a simple first step, eliminates two common triggers. For cons, people miss their food. They miss their gluten and dairy, and unless it hurts you when you eat it. Like, I know that I cannot have either, so it's easy for me. For those that do not experience negative effects immediately, it's harder to avoid. And it's not necessary for everyone, because now you might have the nutritional gaps that are possible. Again, there's micronutrient testing. You could always supplement, but I say keep that. Number five, elemental diet. Pros would be clinically proven to help induce remission, especially in kids. And for cons, it's not sustainable. It could be expensive, some say, and unpleasant taste. I say this is very much a short-term. Kids with a flare, definitely a great option, but you have to find next step right after. Number six, whole food plant-based diet. Great choice, of course. Pros, anti-inflammatory, microbiome friendly, nutrient rich. Great choice. For cons, you would have higher fiber, maybe tough during active flares, so sometimes not an option during an active flare, and it can lack protein if not planned. So be careful to still have your protein there, because without protein you can heal. Number seven, autoimmune paleo AAP. This is great for pros. It targets deeper immune triggers, focuses on gut healing, but it can be very restrictive and time-consuming to reintroduce, easy to undernourish. So it's a big question mark for me. For bottom line, Crohn's and colitis, they're highly individual, and the diet should be the same, and your ideal eating plan should align with you. Your symptoms, your inflammation levels. Working with someone is great. Food sensitivities or intolerances should be really known and investigated. Your gut microbiome, immune system response should be investigated. And here's something most people overlook. Your micronutrient levels might actually affect how well you respond to treatment. A 2023 study in an inflammatory bowel disease journal found that deficiencies in nutrients like B12 and vitamin D and iron may predict how Crohn's patients do on biologic therapy. So even if you chose medications do not cancel out a good, right diet. So that should be staying with you. That does not take away the good, appropriate diet. This is why working with a practitioner who looks at the whole picture, not just the diet, not just the medicine, or a patient as a whole, but also labs and nutrients can make all the difference. If you're looking to create gut-friendly anti-inflammatory diet that works for you, go into my website, digestivereset.com. This is Dr. Ina with you at Digestive Reset. And Melamed Institute clients can go into digestivereset.com. My students who want to learn from me, go into melamedinstitute.health. Comments and questions are always welcome, and I will see you next time.